So for this part of the talk, I want to get a little more practical and hands-on. So we're going to talk about wellness more than actual sickness. And the way I like to think about survivorship is really it's the opportunity to be healthy and to be well and to put illness and sickness and that cancer diagnosis behind you and to look forward. So one of the best quotes I've ever seen about this is, if you look at healthcare today, it's all about disease. It's not about understanding wellness at all. And I think survivorship is first and foremost about wellness. It's about being healthy. It's about feeling well. It's about taking good care of yourself. And this number has been bantered around, but by 2020 there will be at least 18 million survivors in the United States, and 2/3 of them are 65 years or older. So we have a huge population coming down the pike of not only cancer survivors, but cancer survivors who have other medical intercurrent issues. So we won't just be dealing with neuropathy, it's neuropathy and diabetes and hypertension and cardiac disease. I don't know how well this slide projects, but on the left is as of January 2014, and the right is as of January 2024. And you can see that the average number of women and men is going to be about 7 million each, and that's going to go up to about 9 million plus each. But the types of survivors that we have is going to stay relatively consistent, which is for men, prostate, colorectal, melanoma; for women, breast, uterine, colorectal. So why is survivorship important? As has been said many times, survivors experience long-term changes after completion of treatment, which affects the quality of their life. And there is a cost to surviving. That cost is financial, physical, spiritual, and emotional. Very importantly, as has been alluded to, is that caregivers have a tremendous cost, and what this graph shows is what your caregiver is actually worth per disease. And you can see, particularly for lung cancer, the amount of money, so to speak, that your caregiver could potentially be charging for his or her services is up to $70,000 in the course of taking care of you. So it's a highly underpaid, not even close to the minimum wage of $15 an hour. This is blood, sweat, and tears, and this is what your caregivers are really expending in energy. Caregivers also have a lot of unmet needs, psychosocial, medical, daily activity, and very important financial. So for those of you who are doing well when you go home, or if you're not doing well when you go home, thank your caregiver, because he or she is a very, very important part of your life. So what are the barriers to living well after diagnosis? The NCCN recognized several important issues in 2013, and while there are many more, they focused on anxiety and depression, cognitive function, exercise, fatigue, immunization and infections, pain, sexual dysfunction, and sleep disorders. So why bother? Why live well? Most importantly, you feel better. It can improve symptoms and survival. It can give you better off. It can make you better off as far as your overall health. It is life-affirming and allows you to take control in a place where you've been through sometimes weeks, months, years of treatment where everybody is telling you what to do. This allows you to tell you what to do. Why should you live well? Everybody has their particular reason. For some people, it's to get to a graduation. For others, it's to live to be 100. But whatever is important to you is important to you. So let's talk about some of the myths that are important to debunk. These are very common. We hear this every day. So volume 1, I'm too tired to exercise. I shouldn't exercise during treatment. I can't eat well during treatment. If one vitamin is good, 20 are better. Supplements can cure me. Supplements can make me lose weight, and I can take vitamins instead of eating broccoli. Okay. Myth 2, I can't maintain weight on treatment. Treatment will make me lose weight. My symptoms are just part of the process. There's nothing I can do. It's too late to think about lifestyle changes. Natural means safe. The right diet can cure cancer, and if I can't go to the gym daily, I might as well sit on the couch and watch Dr. Oz. Not a bad idea, but... So the reality of survivorship, unfortunately, is uncertainty, and to be a good survivor is to learn how to embrace and work with this uncertainty. So let's talk about a real-life situation, because I think this really explains what many people do go through as survivors. So Nellie is about to begin breast cancer chemotherapy and has many concerns that include and go beyond immediate effects of treatment, including, what if I can't work? How will I care for my children? Will I be able to have more children? What if severe neuropathy happens to me? How will I work? What's my risk of recurrence? How will you find my recurrence? Are my children at risk for cancer? Will I develop cardiovascular disease? What is my future risk of leukemia? What's chemo brain all about? How will I look and how will I feel long term? How do I tell my children, my family, friends, my employers, and will my insurance cover everything? So this is just on day one of the diagnosis. Survivors in general have many questions. What do I do now that treatment's ended? Who will answer these questions? As Kristen spoke about, we need to know, survivors need to know who will take care of them going forward, who is responsible, where does the buck stop? So Nellie's treatment now is completed, and we've all been guilty of this at the Cancer Center. The treatment is completed. Her friends and family are so excited. They have a No More Cancer party. Her healthcare team congratulates her. We all give big hugs and kisses, and it's wonderful, and tells her to go back in 3 months, to come back in 3 months. However, she leaves, and she still has painful neuropathy, making work difficult. Her periods have stopped, and she has no libido. Her cardiac function has decreased 10%, and she's really worried. She's gained 15 pounds. Her primary told her her hemoglobin A1C, which is a measurement of diabetes, is now borderline, and to talk to her oncologist. Now, I consider myself a really good oncologist, but I will tell you that if someone comes to me with diabetes, I really don't have the capability of getting into a full discussion about that. Yet, the internist is a little skittish about taking care of someone who has had breast cancer. So as a patient, you're sort of stuck in this limbo of, my oncologist won't talk about it, my internist is afraid to talk about it, and they just told me my hemoglobin A1C is high. And what do you do? How do you take control of that? She also has anxiety and mild depression, hot flashes that make sleeping difficult, patchy hair growth, poor body image. She's exhausted, and she still has cancer-related financial problems. So while she's worried about this, her friends and family and doctors are giving big hugs and big cakes, and everyone's really happy except for her. For those of you who haven't read this is a beautiful article in the New York Times about a year ago called Loss and Transition. And it's written by Suleika Jaouad, who was a leukemia survivor, and wrote some of the most poignant things. Not that I love Google, for those of you who are my patients out there, you know I hate Google, but you can Google it to find the article, but it is really quite beautiful. And two of the important quotes that I think are very poignant that she writes is, now that I'd survived the cut, poison, burn of the disease, I no longer had the cavalry running after me. Suddenly I found myself standing dazed and alone in the rubble, wondering what had happened and where everyone had gone. As Dr. Rowland said, cancer-free does not mean you're free of the experience. She goes on to write, when I finished my last cycle of chemotherapy in April 2014, friends and family congratulated me on being done. What they couldn't know was that in some ways, the hardest part of my cancer experience began once the cancer was gone. And also you had mentioned Dr. Roland Ellen Soval, who actually passed away. ASCO had the first survivorship conference this past January, first survivorship conference ever, and she passed away shortly before that first conference and was widely spoken about, and I think just writes beautifully that survivorship is a condition of its own. It's not something that anyone can understand until you've actually gone through it, until you actually feel that uncertainty. And the way I think it's most beautifully described is with this little vignette. I'm okay, but I'm not. I'm not happy. I'm not sad. Most of the time. I don't even know. I feel confused. I guess I'm living, but I'm not. Survivorship is a time of uncertainty and confusion, but it's also a great time of hope, because each survivor's experience and issues are unique. Even though everyone may be a survivor, what you particularly want going forward is unique. And survivors need strategies for wellness. If you don't know what to do, you don't know what to do. So walking out the door, being congratulated on your last treatment and having someone say, now go lose weight and eat well, and by the way, try and relax. Really, try and relax. Now, anyone who's ever had cancer, you can't imagine relaxing. So we need strategies for techniques to do all this. The ASCO initiative has looked at this as a teachable or the aha moment to increase education and awareness, provide tools and resources, foster research to deal with the pathophysiology, behavior changes and outcomes, best methods for lifestyle change, to advocate and to improve access to care. And the basic tools for living well are essentially lifestyle changes, diet and exercise, integrative care, so things like massage, mindfulness, knowledge, and communication. I do have more slides, but this might be a good point to stop and take questions, so we have time for questions. I can do